Well, the UK government has released their strategy for how they're going to roll out the vaccine. They're going to start with the highest risk individuals, so people in aged care facilities, healthcare workers, and then work their way down through the list of people that follow on from that in terms of their risk, and that relates to things like ages and professions and other risk groups.
There'll be enough to vaccinate 20 million people. Over what period of time are we expecting to see it have an effect on COVID numbers?
It'll take some time. So in terms of having an effect on COVID numbers, what we need to see is sufficient coverage in the population to dampen the level of transmission. So initially they're going to be focusing on high-risk individuals, and so the strategy will be to protect those individuals. But when we come to talking about the population at large, the general community, coverage rates will need to reach a particular level. So it'll be a high proportion coverage in order to actually have a proper to have an impact on the trajectory of the pandemic, and that won't happen for some time.
So what factors come into consideration when deciding whether further consignments will be ordered?
It'll be, like I say, initially it'll be trying to protect people who are at high risk, and then it will be looking to protect the community at large. And so I imagine that they will be, there'll be a number of factors at play. It'll be how quickly the vaccine can be produced and how quickly it can be disseminated. It's a very complex business, rolling out large-scale public health programs like that. Of course, there'll be lots of international competition for access to vaccines. There's a global coordinating body that's been established, and so that will roll out throughout 2021.
Well, the US's Dr. Anthony Fauci has apologised for criticising the UK's vaccine approval process, which the UK, of course, has completely defended. What are your views on the speed at which the UK approved the Pfizer vaccine?
I don't have an opinion either way. I think obviously this is a major priority for ministries of health around the world and for regulatory authorities. And of course, every regulatory authority is directing their attention to this process of approval. So things are moving more quickly than you would normally see. It just so happens that the UK has moved more quickly. I don't necessarily think that means that there's any laxity in the way that they've applied their quality standards. I just think that it's been a priority for them and they've moved quickly. I don't think I don't see any controversy with that.
Of course, the EU begs to differ. European regulators say their longer approval process is safer. Does longer necessarily mean safer?
Not necessarily. I think safety is achieved through the application of rigorous evaluation of data and safety procedures. No, I don't necessarily think that longer means safer. I think it's every country needs to go through the right processes, and I don't have a problem with the approach that the UK has taken.
Well, turning to the US, Joe Biden has announced that he's going to ask the public to wear masks as soon as he's inaugurated for 100 days. Quite arbitrary, do you think, the number? Shouldn't the science dictate how long masks should be worn for?
Well, of course, science is very important, but then, of course, public health messaging is also important. And, government leaders need to provide clear and consistent messaging. The other thing that people need to acknowledge or recognise is that the US president doesn't have the authority to make directives around how state health departments implement public health measures. So he's doing what he can within the constraints of his position, that hence the directive. Wearing masks is not the only strategy that jurisdictions will put in place for tackling COVID. It's not the panacea. It's not the answer to how the United States is going to tackle the pandemic. It's much more complex, and he needs to work collaboratively, obviously, with health authorities and with the states who actually have the real mandate to implement public health measures in that country.
And Professor, when do you think the majority of jurisdictions will have access to a vaccine that they can roll out for widespread use? Can we put some sort of a timeline to it at the end of next year, perhaps, or when would you say?
It's the million-dollar question, and it's a very complex question to answer because it relates to. There are many factors that impact on the answer to that question, including country-level approval processes, the ability of manufacturers to scale up production, and the international rollout of vaccines, which requires international coordination.
And just finally, as countries begin to start vaccination programs, how soon might international travel resume, and what are the precautions that need to be taken here by governments around the world?
I don't think that free travel in the way that we experienced it pre-COVID is going to happen anytime soon, certainly not in 2021. There'll be conditions around travel. It may relate to whether you've been vaccinated. There'll be conditions that relate to the jurisdiction that you're travelling from and the place that you're travelling to. I don't think we're going to be seeing free and unrestricted travel at least until 2022.
Professor Archie Clements, thanks so much for your time. Really appreciate it.
You're welcome.